On the way here, it was kind of a bit chaotic. But we were in the ambulance and they weren't sure whether we were going to go to Pinderfields or we were going to go to York. York was closest at the time, so we were it was a battle to get there. So in the end, went to York, and we were seen super quickly. And the doctor at the time kind of had said, "Okay, I think we're pretty ready to go home." And we were like, "Oh, we're going to patch you up and go home, maybe see you." And then he'd taken some notes and then had come back in and said, "I think I'd like you to send you to Pinderfields." And because they'd given her some drugs to make her sort of less in pain, they suggested that we drive there. Because the wait for the ambulances was so long. At first I was a bit anxious about, well, for one, taking her home was the possibility, and then two, drive into somewhere we'd never been with Sophia small and wrapped up in bandages and things. We just said, okay, we'll take her kind of thing to Pinderfields, and it was sort of a 45 to 50 minute drive because of the traffic. Even just getting her into a car seat was very nerve-wracking, sort of being patched up and then sent on our way. But she was in and she was fine and she didn't cry, and so we were kind of slightly settled in the car. Everything was all very strange, like we didn't know what's happening. So they just kind of said, turn up and they'll go straight to the burns unit, and that's kind of what we did. We were there within an hour, and that was kind of the very beginning, I suppose. I don't think we were thinking right. It's one of those things that you just get told to, like, vague instructions, and we were there. So we came in and we had a really short wait in the waiting room. And Sophia was really calm because obviously she'd been given some painkillers to just take away any of the immediate pain. The nurses had come in to see us, and then obviously the doctors come in to the room that they're going to assess the burns and things like that. And they kind of had warned us, it's going to be quite visually scary to see, but they're going to have to do it and they're going to have to scrub her down. And I don't think me or Ollie were quite prepared for what that actually involved. The literal scrubbing of the skin was horrific. Like, she screamed, I cried, Ollie cried. It was painful to watch. Yeah. The nurses were great. They were singing. It was like everybody was just so, it was like normal. So like we were out of our depth, and they see it every day. So kind of put you at ease, I think. We realised the depth of what we were dealing with. So they patched her up once they'd scrubbed her down, and they'd given her more pain relief. They showed us to the room, they showed us to the play area, they showed us, they just showed us around, and they kind of said, we don't know how long you're going to be here. And we were like, oh, okay. By the time all this had happened, it was sort of the evening, so the night shift people were coming in, and they were great actually. They sort of, I can give you Chinese takeaway menus, just let us know. They just really sort of make you want to settle in, and that's kind of what you felt like there, I suppose. During the accident, I had burned my knee, and we hadn't realised what had happened to my knee until I was complaining. At York Hospital, they'd bandaged it up, and then it slipped and it was rubbing and it was really painful. So I asked if one of them could just re-bandage my knee, and when they'd seen it, they sort of said, "Oh, okay, we need to sort you out." And even though it's paediatrics, and I felt like they were, looking after us all, so it was great. Yeah, so it was sore, and I think you kind of just you put it to the back of your mind a lot. So I hadn't realised just how sore it was until maybe 10 hours after it had happened. All your attention is on the little one, and you can't. I just didn't prioritise me at all. They said, "Oh, you're gonna have to go downstairs," and I was like, "No, I just put a dressing on it and it'll be fine." And I just kind of got on with it. I just wanted her to be okay before I was okay, but I think that's quite natural. I think you just think that you want her to recover as quick as possible, but then because you're in just one room, your imagination just goes wild. Like, I've always been, because of my job, very in control of everything, and because I wasn't in control of this situation, like, my mind did crazy things. This sounds awful, but you think, of what other people are going to think of you. Like, oh, she's a terrible mother for letting this happen, because you're in this like environment where there isn't much to do, you just plays tricks on you. I lost a lot of confidence in those first 7 days of her being there. It was really unusual for me because I'm very in control and I can make decisions, and it has to be part of my job to do that. So for me not to feel like that for my little one was really hard. And I think I relied heavily on Ollie as well, because Ollie was like really strong and he kind of just dealt with it a lot better than I did. But I think that's because I was in the room when her accident happened, but he just seemed to sort of manage it as totally different to how I did. So it was really dark few days of kind of questioning everything that you've thought that you were quite good at. Like, thought I was quite a good parent, and then for that to happen, you're just like, what a mistake, you know? While we were in the ward, I felt like I didn't have to see anyone, and I didn't have to talk to anyone, and I didn't have to tell people what had happened. So that was fine. I could stay in that little bubble. But when they said that we could go home on that 10th day, I didn't want to leave. Actually going home, the nurses who changed her dressings were very good at sort of being very realistic about how you should be with her. After the first day of her being bandaged up, it was like she didn't even realise that like she was in pain. Like, she wasn't in pain, she was like a normal child running around the place. So it was really weird for me to see her acting so normally 24 hours after. And I don't think I could process that, because when you have a big burn on your chest and on your arm and on your knee, like, I get tiny burns all the time at work, and like, they hurt. And I just couldn't comprehend that she was sort of running around all the time and smiling and laughing. It was every time we had a dressing change, it was like the nurses would point out the different things of, look, it's getting better, that one's getting better, we need to watch this one, but it looks like it's getting better. Constantly pointing out that she was actually getting better, and I couldn't see it, but Ollie, he like kept the photos on his phone, and he was like, look at the difference. And I think that whole process sort of started to clear your mind a little bit, that actually she is going to be okay. And I think it was maybe just me that wasn't. It felt like I had this person sitting on my shoulder saying, no, that's not how you do it, or that's not the right way of cooking tea anymore. It was hard to shift that. Just the little things, so not wanting to leave the hospital after she could have been discharged, or I took a bit extra time off work just to kind of, I don't think I really wanted to see anyone. Like, I just didn't want to talk about it. I wanted to like put it at the back of my mind and pretend it never happened. I think I realised you just can't live like that. So I sort of pushed myself to just get on with everything. And I think I did. I threw myself into sort of housework and, you know, cleaning. I think I just wanted everything organised so I could see everything clearly. And there was an option to not go home, but Ollie had kind of said, you know, maybe you should talk to the psychologist and see how it goes and then make the decision afterwards. Seeing the psychologist had never even like been in my train of thought. I don't think I never thought that was an option for me, and I didn't think it was maybe the right option at the time. I'm quite stubborn, so to talk about things I don't want to talk about is uncomfortable. I suppose it's for anyone. I kind of realised, oh, actually I think there might be something wrong. Not with me, but I think there might be something wrong in the way I'm thinking. So I said, yes, I'll go home. And then I think that's when we kind of put in place a plan to talk regularly with the psychologist. And so sort of the next stage, so Sophia was going back to Pinderfields every 3 days to get her dressings changed until the chest and the arm was better. The knee was taking a lot longer to heal, so we were there for a bit longer, going backwards and forwards, but in between then we arranged visits with the psychologist. After the first session I kind of realised that I needed that, and then I kind of just got into the swing of it, and it just felt easier. Every session felt easier to talk about things. We'd been in and out of hospital with Sophia when she was tiny because she lost a lot of weight. And when we'd been there previously in the hospitals, it was always like I'd always wanted to just get home, get back to normal as soon as possible. And then this time when it came around and I didn't want to go home, it felt, I couldn't understand why. And Ollie had sort of said that had worried him the most, that I didn't want to go home. And I think it was the fact that I would have to see people and they'd ask questions because she had big bulky bandages on and it drew a lot of attention. I didn't want to go through the process of having to explain to everybody what had happened. It sounds horrible, but I didn't want people to think that I was a bad person. And so it was really unusual. And even like going back home, there was things like, well, I don't want to make poached eggs again or things like that, but it wasn't even that. It was just being in that house. I remember saying that the house felt so small and like I hated it being cluttered, but I had like a 18-month-year-old running around, so you can't have it spotless all the time. And it was really an unusual feeling, and I think all that from not wanting to leave was just, it was sort of built up. I think it was just all those anxious feelings that suddenly just surfaced. We got home and it was just kind of straight back to normal. Those terrifying feelings of having to talk to people, actually it wasn't anywhere near as bad. And like people on the ward had sort of said that you know, it might feel a bit strange going home, but actually you'll feel better for being at home. If I think I'd stayed back in the ward, it would have been a lot harder to transition the coming weeks of Sophia being in bandages at home. So I'm so glad that I just took the plunge and went back to normal for a bit. So the constant connection back to Pinderfields, like even if it was just going back to have the dressing changes, usually it would like go inside with the like psychologist appointments, and it might just be like a half an hour chat, and I think it just helped sort of clear the air of any anxieties that might have been building. Like I didn't ever think I was an anxious person, but this sort of really raised its head. Those aftercare of coming back actually really helped, because you could see from her getting better and also like me feeling more comfortable and building my confidence back up again was sort of very needed. I think if I'd just kind of carried on like gone straight back to work and gone straight back to like reality. I think maybe I could have been in a very like darker place now than sort of where I am now. The first couple were very hard because everything was very raw. The second one was when the surgeon came to see if she might have needed surgery on her leg, and he'd kind of, I don't think it was ever intended to come across, but it kind of, the way he'd said, oh, she may need surgery, was almost like a big like slap in the face almost. I felt hot and dizzy, and it was just, you don't expect somebody to, well, I suppose you should have done because it was a surgeon, but I think the reality of, from the nurses saying, you know, it looks like it could heal, surface burns kind of thing, to, oh no, I think she is going to, was like, I didn't realise just how powerful that was. But then it turns out that she didn't need it, so it's fine. But I think when you're in sort of a very small room and there's sort of 2 or 3 nurses and a doctor, and she's like exposed, like all the burns were exposed, it was shocking. I felt very lucky that I was in that situation, because other parents probably had got it a lot worse. And I think that's what kind of shocked me the most, was that like everybody's got a different situation, and I was quite grateful that it was sort of not as life-changing as others could have been. You're guilt-ridden, aren't you, I suppose? Like, I think that's the main thing, like you just wish they would never have been there in the first place. They still shocked me every time I saw them. Like, it was almost like breathtakingly. Ollie got almost like obsessive of like, oh, it's getting better, look at this, it's getting better, whereas I would just see it and just be still, like borderline sick feeling. Now when I look at her and you can't see anything on her top half and you only see the raised bit on her knee, even that raised bit on her knee still sort of gives me that shudder. I don't think it'll ever go away really, but you kind of just learn to sort of cope with it. Just seeing her day to day, you know, she's in terrible twos right now, so you know, just her being absolutely normal is running around, climbing on things that you want your child to be perfect in every way, but actually, like, it didn't matter. Like, as long as she was, you know, absolutely fine. You obviously don't want your child to be permanently scarred, but if it is, you just manage it. Like, we still have to, you know, protect the one on the knee, and it just becomes part of life, doesn't it? Like, it's just a little thing. When she sees it, she goes, ooh, and I'm like, oh, it's better now, isn't it? And she'll go, yes. So it's just part of them now, and you've just kind of got to embrace it, I suppose. Like, what's happened has happened. You just got to live with the memory of it, I suppose. Like we discussed in our sessions with the psychologist, of almost like putting it in a box, and like I always now use that as like, it's in a box and that's it.